hour, I should say. And today is all about respiratory hazards. So we're doing things a little bit differently today. We're joined with a partnering organization, OHCOW, that's the Occupational Health Clinics for Ontario workers. So we're happy to have our Executive Director, Kimberly O'Connell, here today to speak on what OHCOW is doing in that area. And then we also have a co-presenter from CROSH, Dr. Katie Goggins, to speak a little bit more generally on respiratory hazards and what we can offer and what kind of services and stuff is out there to help. So the webinar is about 40 minutes long. We're going to get each speaker to present for approximately 15 to 20 minutes. We're going to hold off all the questions until the end. If you do have questions on your mind that are burning, don't want to forget, you can post them. There's a little chat box, and I'll relay them to the speakers at the end. And with that, I will welcome Kimberly up here to speak first. Yeah, we're good. So Kimberly, thank you very much.
I have a question.
Sure.
That I'm supposed to hold to the end. Will the live links work? I forgot to ask that. Like, I have links in there. Will they connect to the internet?
It will not. If it's in the PowerPoint, then it's fine. But
okay. No, perfect. In the PowerPoint. Excellent. Thank you, everyone, for joining us today. I am an occupational hygienist by trade. So I'm the director of the Ottawa and Sudbury and Thunder Bay temporary clinics for occupational health clinics for Ontario workers. But really, I'm an occupational hygienist in my background. So I tell my kids that I thought I wanted to be a doctor, but then I realized I wanted to help people before they got sick, and that's what today's really all about. You'll notice that my slides have the OHCOW logo, but also the provincial logo and the Healthy Worker, Healthy Workplace Initiative. And that's what today really I'm going to be focusing on. So why? Well, occupational disease is rampant. Basically, these are some statistics that talk about that in general. But we've been outnumbering traumatic fatalities on the occupational disease front every year since 2012, and this is only increasing. Where the leading diseases resulting in deaths include mesothelioma, lung cancer, and I think Katie's going to be talking a little bit more specifically about some stats around mining. But these are only the numbers that I'm showing you are really, you need to take a minute because they're numbers and they don't seem to be having impact. $950 million costs. But really, this is only those that have been accepted. We know people die every day and doctors don't ask etiology. So why did you get cancer? Isn't even a question a lot of the time. So really we do our work, but we want to prevent those illnesses and eventual deaths. So what happened and why are my slides kind of all-encompassing of the system partnership? I'm really proud of the Occupational Disease Action Plan. And Val Wolf from our OHCOW clinics chairs this, co-chairs it with the Prevention Office of the Ministry of Labor. And it has involvement, I'll show you, from all organizations, including CROSH, across the health and safety system partnerships. So this group identified priorities, so selected priority exposures, noise, diesel engine exhaust, allergens, irritants, and developed activities for that action plan across a wide range of prevention approaches, including research and data, education and training, and enforcement and awareness. Other priorities were identified were general occupational disease awareness and research on emerging issues. For example, I'll talk about later the engineered nanomaterials. So the implementation of ODAP, or the Occupational Disease Action Plan, is initially assigned to these 5 working groups. And then, as you can see, we added just most recently, as my circles are off. Oh, this is an old slide. Oh, no, I have it over right here in asterisks, the Respiratory Hazards Working Group. And that was because of, this is the whole system partnership. That was because of a need or a thought process where we would utilize an enforcement activity that was coming up through the operations group at the Ministry of Labor called the Healthy Worker, Healthy Workplace Initiative. And I'm going to talk to you a little bit more about that. but I'm also giving you the backstory of the Occupational Disease Action Plan. Have I lost anyone with all these names so far? Okay. So one of the things we're most proud of, and this is where we check, well, I'll do it in the next slide, is the Prevent Off Disease website, where all of these system partners are working together, including CROSH, CREOD, the Institute for Work and Health, Occupational Cancer Research Center, all of the health and safety system partners, the Workers' Health and Safety Center, OHCOW, the Health and Safety Associations, WSIB, even public health, and some of the working groups, the Lung Association, super important, and some of the working groups have brought in outside of Ontario, so Health Canada, on the Nano Group, National Research Council, the Diesel Group's been bringing in SOCAR, and other organizations that can affect impact, and everyone's sort of aligned, trying to prevent this crisis, really. You know, we call climate change a crisis. We're trying to call it an emergency. It's sort of the similar, we'd like to see a similar messaging for occupational disease prevention. So was created in the, just before the summer kicked off, the Respiratory Hazards Working Group. And what this group did was, it has a presentation by the aforementioned companies, and it added a few priority substances to the Occupational Disease Action Plan table. So we wanted to add asbestos and silica, and then leverage the other working groups. The diesel exhaust emissions working group, we're pulling in what they've been doing. The the allergens and irritants working group, which was talking to isocyanates, clean products, paints, and solvents. And so far, this working group, I'm chairing along with the Prevention Office, Nancy Bradshaw and Avril Beaubier, are chairing this group. And so far, what we've accomplished was getting ready for this healthy workplace, healthy worker and healthy workplace initiative I'm about to talk to you about. So we did an environmental scan, an inventory of resources from all of the system partners, and we uploaded that to one central space. So and I'll show you that Prevent Off Disease website, which was a partnership with CCOHS. So it's got a national flavor to it, in addition to our efforts in Ontario, and I'm going to speak more about that as we go. We were able to do some presentations at various Partners in Prevention conferences and Northern Partners Knowledge Exchange. The Health and Safety Associations, along with the Prevention Office, built toolkits for this Healthy Workers and Healthy Workplaces initiative. There are some amended regulations coming up that this working group will likely also leverage in our work, which I'm going to talk to you about. And we are hoping for best practices tools development. So things around risk assessment, controls, exposure and surveillance databases. So I'd like to show you the resource that CCOHS and OHCOW partnered with as part of the Off Disease Action Plan and cannot locate internet server or proxy. Maybe not. Oh, I don't see that on my screen. I need technical help. I see okay on your screen, but not on this screen. Thank you. So we might not be able to go to the website? Okay, I should have asked that before. Sorry, guys. So go to it. Just this is your homework from your presentation when we ask about what action we want you to join the action plan. That's what this is all about. It's not a secret club. It is everyone trying to do something to prevent off disease. So this is your homework early on in the day, is to write down this website and go to Prevent Off Disease. It's a clearinghouse, really, or a portal. It's not your typical website. You can submit resources to it. So you'll see that we have information there under a number of categories. And the Healthy Workers in Healthy Workplaces initiative around respiratory hazards are pointing people as their action to this portal. So again, please do visit, see what we've got. It's a work in progress. It's a dynamic site. We just really wanted to try to have a central clearinghouse for all of the good information out there around off disease, instead of going to thousands of different places. We have NIOSH information on there. We have OSHA information on there. It's not limited to Ontario. We have Work Safety C stuff on there, and we're only at the beginning. So things that you might use in any of your efforts out there as if you're online as health and safety professionals or joint health and safety committee members, take a look at the website and please feel free to add content because it's a work in progress. So it is Lung Cancer Awareness Month this month. So this is part of the Healthy Workers in Healthy Workplaces initiative. And this is just a visual of the toolkit that I was mentioning that's available for your viewing pleasure on each of the health and safety systems websites. So I don't think I'll be able to click to that. That's okay. You can go to the Public Services Health and Safety Association to see the toolkit and some of their specific to healthcare resources. You can click to Workplace Safety North and see some of the specific resources for mining, forestry, and some of the northern stuff. They all also have webinars for you to view in archive. So they were done in September timeframe. And this toolkit is available on all of these. So the point is to get people going to Prevent Op Disease, and then also going to each specific health and safety association, depending on the sector that they work in, for more specific tools to help them with this respiratory hazards part of the initiative. So what are Ministry of Labor operations? Oh, I'm sorry. And of course, we also have Workplace Safety and Prevention Services for industrial, and Infrastructure Health and Safety Association for construction. So what are the Ministry of Labor inspectors going out and looking for? And this initiative started in September. We had a part one webinar where Trevor Shell, our ergonomist, talked about the Healthy Worker and Healthy Workplaces initiative includes musculoskeletal disease prevention as well as occupational disease prevention or respiratory hazards. So I gave you some stats up front, and I'm focusing on the respiratory hazards today. But this initiative where inspectors are going into workplaces, on the old term being Blitz and now initiative, they're trying to create compliance assistance for workplaces with this initiative, and then they will be going into workplaces, and this is what they'll be looking for. So in the construction industry, they're looking at, what are, and I'm only speaking to the respiratory hazards piece, so they're looking at gases, dust, vapors, and fumes that may be present in construction projects. And you'll see specifically they're going to be looking at silica dust from cutting or breaking concrete, friable asbestos being disturbed or removed. I won't go through the whole list, but they're here for you to, this is what, to prepare for in your workplaces and what the inspectors will be looking for. And again, Prevent Op Disease and the toolkit and each of the health and safety associations, as well as OHCOW and the Workers' Health and Safety Center, are where you can go for help. And CROSH and all the research organizations. In healthcare, they're really going to be focusing more on cleaning agents and checking records of asbestos-containing materials in hospitals and healthcare. So you see here, they'll be looking at handling of hazardous chemicals, such as cleaning agents and preservatives. They'll be looking for written measures and procedures, and they'll be looking at personal protective equipment. And you'll see some of the regulatory amendments that are coming. We'll be focusing a little bit on that as well. And of course, they're looking at asbestos-containing materials, and that people are following Ontario Regulation 27805. In the industrial organizations, the inspectors will be focusing on respiratory hazards related to crystalline silica, as well as welding fume and diesel exhaust exposure. So here they'll be looking at control programs because a few of these are designated substances. Again, you'll see regulatory change coming here, and methods and monitoring for workers and workplaces for airborne concentrations. They'll be looking at medical surveillance, respirator use and fit testing, and worker training. And Katie's going to talk all about mining, so I'll skip that slide. That's all I have around the Healthy Workers, Healthy Workers and Healthy Workplaces initiative. And now I wanted to, because it was focused on the respiratory hazards working group, And I did want to tell you a little bit about the accomplishments related that we're pulling into that group from the Allergens and Irritants Working Group and also diesel exhaust. So this is a slide that Dr. Lynn Holness, who's chairing this group, presented at our October event, and really just talks about the accomplishments that this group has achieved in the last year. So they were able to provide system priorities for lung and skin allergens and irritants, and with a focus on wet work, isocyanates, preservatives, and cleaning agents. So you can see things are really aligning. This seems common, or seems like a no-brainer, I guess, but this didn't always happen in Ontario or in the system. Everyone would kind of go off on their priorities, and maybe messaging would be different. So we're really happy that occupational disease is being looked at so cohesively through all the organizations, and that's credit to this occupational disease action plan. There's some supporting information provided by each health and safety association. Particularly, there's a link here to the Infrastructure Health and Safety Association for cleaning agents. Public Service Health and Safety Association has some. So top allergens by sector and gaps in prevention were identified for workers with skin diseases. And they are looking at analysis of North American data to further refine the top allergens by both sector and even by occupation. So this is really good work going on. And they're looking at an e-learning module for skin prevention and screening for healthcare workers, which is being developed to improve prevention and early detection. And there are further resource development and support system. They're actually looking at developing, as part of both the Respiratory Hazards Working Group and this working group, some fact sheets around the codes for medical surveillance that are changing that I'm about to tell you about as well. In terms of the diesel working group, the chair is Kevin Hedges, another occupational hygienist at OHCOW. And that group's been able to brought together, again, a really diverse group outside of just the system partnerships that I was able to tell you about. So the key stakeholders here include the Southern Ontario Centre for Atmospheric Aerosol Research, CanMet Mining, at MDEC, so the Mining Diesel Emissions Council co-chair and secretary, and then the Mine Review that Kevin's also part of, and Morarco and the Teamsters Rail. So we're really trying to extend the reach of this work, getting to the right people. They did a workshop session on diesel exhaust at October in 2018, and you can see those videos online at the OHCOW website. And also we did a CAREX Occupational Cancer Research Center webinar. They did, CAREX and Occupational Cancer Research Center, supporting this working group, and that's also available online. And I should really provide these links somehow afterwards. We'll figure out a way to do that. And Workplace Safety North has some really great infographics and training materials around diesel exhaust available as well. So these are some of the accomplishments of all the system partners working together on this subject matter. And industry leaders as well, PH Bulletin, some presentations, and even Kevin's work with the Workplace Health Without Borders around this subject matter has been very helpful as well. So we're, again, looking outside the box of the province of Ontario and trying to grab best practices from industry, from internationally, from nationally, and you'll hear more about that now. So how am I doing for time?
Give you a few minutes.
Okay. Great. I think this is my last slide, Katie. Okay. Maybe two. So our next steps. So the working group where respiratory hazards are important. They're part of the Occupational Disease Action Plan. They wanted to align with the Ministry of Labor Operations initiative, but we have other or next steps that we are working in parallel with, and one of them is our Nanotechnology and Health Network, which didn't want to forget emerging issues. So Todd Eyrich chairs this work. It's not really a working group, it's sort of a network. It also includes Health Canada, and we did a partnership back on another slide also with CCOHS, and there's an e-tool available around nanotechnology. It's 20 minutes, it's free, that people can learn about that kind of emerging issue or hazard that is respiratory, as well as, there's debate about all the routes of entry into a body when molecules are that small. And I did want to talk a little bit about, some of our next steps. Maybe I'll leave regulatory change. This is in reverse order because the regulatory changes around respiratory hazards are coming effective in January. So probably the next work of the Respiratory Hazards Working Group will help support that regulatory change, but also we really want a focus on tools for people to reduce exposure. So when I say control tools, one of the, just looking for a little paper that I left on the table, sorry. One of the control tools that the Respiratory Hazards Working Group looked at was just, we had Dr. Hugh Davies and the BC Construction Safety Association come to present to our working group around this Silica control tool. And could we utilize this great tool that's being utilized in BC in Ontario, or can we use it nationally? So that's on the table right now. They presented to us this amazing tool that, not everybody can follow traditional hygiene practices. Mom and pop construction shops out there are overexposing people to silica on a daily basis. Can they use exposure data from other areas to then implement controls right away? Can they wet their work? Can they spew out a control program based on data from other similar operations? Yes, hopefully we can. We don't need to bog ourselves down in the science when we know that we're hurting people. We need to control it. So I think that's where a focus of this working group would like to go with that as an example. So stay tuned for that. That was a little sneak peek on some of the things that we've had. And also I did want to mention that OCRC, the Occupational Cancer Research Center, held a really good national occupational disease surveillance workshop just earlier this month. So there's a lot going on around respiratory hazards, and there will be a report out around this from Dr. Paul Demers and I'm not sure, maybe Nate from Occupational Cancer Research Center, but they wanted to provide an overview of surveillance options nationally. So medical surveillance, disease surveillance data, exposure data. Dr. Hugh Davies also presented at our October event, which you will be able to see by video as well, around his exposure database all over Canada, CWED. So we're trying to pull best practices from all over the country and internationally is really the common theme that I want you to hear. And we want to be leading edge in Ontario. We want to be preventing, we want to be getting ahead of this because right now we're very much lagging behind. The regulatory changes, I think I'm running out of time, but I will tell you a little snippet around those. Basically, it's an occupational health regulatory modernization amendment is what they're calling it. So what they did was they replaced the 9 separate medical surveillance codes with one single consolidated and updated medical surveillance code. So, learn more about this. You'll see if you go to the Ministry of Labor website, you can download some of the documents. They also replaced the 16 separate codes for respiratory equipment and measuring airborne substance with new updated and consolidated respiratory protection and measuring provisions, which is excellent news. And although in prevention, we're always talking about, well, one of my points, substitution and engineering controls first, and personal protective equipment is the lowest on that hierarchy, it still is a control. It's not our favored control, and we want people to engineer away and substitute away these hazards, but when they can't, and only when they can't, respiratory protection needs to be the appropriate respiratory protection. I tell you, if I had a penny for all the workplaces I went into where people had a false sense of security with a, day-old scrub stubble trying to put on a respirator or the wrong respirator altogether, thinking they're protecting their lungs, we have to do better. So They also are permitting businesses to use the Quebec model for calculating exposures to hazardous substance for irregular work shifts. So prior, there was no real mention of, the TWA, or the time weighted average, is based on an 8-hour workday. Well, lots of people work more than an 8-hour workday. So what's your allowable limit when you're working irregular shifts? So they're addressing that with this upcoming regulatory change in January. And of course, our favorite, which this is not my order. This is the order from the Ministry of Labor website, but adding substitution or substituting hazardous substances to those with a less hazard has been added finally to the hierarchy of control. So that's very good, good news. So we're going to skip questions and comments and head over to CROSH for a little bit of a deeper dive into mining respiratory hazards, but I'll be around for questions or comments later.
Thank you, Kimberly. We will find a way to get those links sent out to people as well. Just bear with me for a moment as I pull up Katie's presentation.
What's that? Okay, awesome. So I'm Katie. My research expertise is more in vibration, but we'll do our best to give respiratory hazards a good presentation. So some respiratory hazards in mining. Some examples of exposure that can lead to occupational disease in mining are going to include the blasting gases, diesel emissions, which Kimberly talked a lot about, and I'll be talking a lot about. Drilling, mucking, and rock baking activities will lead to silica or general dust exposures. Refining, so this is where you'll get your metals, sulfur dioxide, dust, and chemical reagents. And then welding fumes, and this is just from the heating and burning of metal surfaces. So some common respiratory hazards in mining, there's respirable crystalline silica. So silica is the second most common element in the Earth's crust and is found in many types of rock and ore. When very small respirable size particles are created and inhaled by the workers, they can reach into the deepest areas of the lungs. For asbestos, it's a name given to minerals with a fibrous habit that may be found naturally occurring in rock or ore. And then if these fibers are released during exploration activities and inhaled by workers, they may also enter the lower regions of the lungs. Nuisance dusts, these are just non-toxic, insoluble dusts that can accumulate in the lungs when they're inhaled in large amounts, so as they cannot be cleared fast enough by the body. So this condition is known as dust overload, and it can also contribute to lung-related diseases. With the diesel engine exhaust, or DEE as you're going to see it, it's a complex mixture of gases and particulates produced from the combustion of diesel fuel. So it's been classified as a known carcinogen based on the evidence that it causes lung cancer. With nickel compounds, nickel is also naturally occurring metal, commonly used to form alloys such as stainless steel, and in applications such as batteries, electroplating, ceramics, and chemical reactions. There's strong evidence that nickel and its compounds can also cause lung, nasal, and paranasal cancers. So some examples of occupational disease in mining will include asbestosis, which is a long-term inflammation and scarring of the lungs due to asbestos fibers. Some symptoms may include shortness of breath, cough, wheezing, chest tightness. There's also mesothelioma. It's a type of cancer that develops from the thin layer of the tissue that covers many of the internal organs, known as the mesothelium. And so the most common area affected is the lining of the lungs and chest wall. With the cancers, they'll include lung, nasal, or gastrointestinal cancers. There's also chronic obstructive lung disease. So this is a chronic inflammatory condition of the lungs that causes an obstructed airflow from the lungs. Again, the symptoms are very similar: difficulty breathing, coughing, overexcessive mucus production, and wheezing. Emphysema, so as depicted on the right, is a lung condition that causes shortness of breath. In people with emphysema, the air sacs in the lungs, or the alveoli, are damaged, and over time, the inner walls of the air sacs, they weaken and rupture. So this creates larger air spaces instead of small ones, and this reduces the surface area of the lungs, and in turn, the amount of oxygen that reaches your bloodstream. There's also skin diseases, as Kimberly alluded to. Repeated exposure to hazardous dust can cause dry, irritated, or skin burns or allergy reactions. And then hearing loss is also an example of a common occupational disease in mining. So as it's Lung Cancer Awareness Month, I'm going to take this opportunity to talk about a report published in September of this year. So the Occupational Cancer Research Center, or OCRC, published a report on the burden of occupational cancer in Canada. The objectives of the report were to describe and quantify occupational exposure and burden estimates by industry and/or province for the most important occupational cancer risk factors in Canada, and to present policy recommendations and workplace-based opportunities for reducing exposure to occupational carcinogens. Over 100 occupational exposures have been classified as definite or probable human carcinogens by the World Health Organization's Internal Agency for Research on Cancer. The OCRC has estimated the cancer burden of 44 of these. And although many of these carcinogens are found in Canadian workplaces, this report focuses on the 13 occupational carcinogens that contribute the most to the cancer burden in Canada. So these carcinogens can include arsenic, asbestos, benzene, chromium compounds, the diesel engine exhaust that we're talking about, secondhand smoke, nickel compounds, polycyclic aromatic hydrocarbons, radon, night shift work is actually in there as well, silica, and solar ultraviolet radiation, and finally welding fumes. The researchers estimated the burden of occupational cancer in Canada in 2011 using methods adapted from a major study from the United Kingdom. So the estimates incorporated information on the workers' exposure to specific occupational carcinogens between 1961 and 2001, the time period of exposure, which would have been expected to contribute to the cancer burden in 2011. They also used the strength of the association between the exposure and cancer outcome, changes in the working population over time, and statistics on the number of cancer cases and cancer deaths by cancer site, by province, and by sex. Of the 13 occupational carcinogens in the report, I've pulled out the results of 3 where mining as an industry was in the top 3. So it was found that occupational silica exposure causes approximately 570 cases of lung cancer each year in Canada. The majority of these lung cancers are diagnosed in workers in the construction industry, followed by the manufacturing and mining industries. Altogether, these cancers amount to about 2.4% of the lung cancer diagnosed annually in Canada, but for mining specifically, this amounts to approximately 80 lung cancer diagnoses each year as an industry. So workers in the underground mining industry are particularly susceptible to exposure due to confined workspaces. Then high levels of exposure occur primarily in people working underground, where diesel-powered equipment is commonly used and ventilation can be poor. For the mining industry, it was found that less workers were exposed to low or moderate levels, and mining mostly had exposures at high levels. So this increase is actually reflected in the burden estimates. Approximately 560 cases of lung cancer are diagnosed annually in Canada from occupational exposure to diesel engine exhaust. This, again, is 2.4% of the estimated total lung cancers diagnosed each year. The burden of lung cancer is highest in mining, where workers are exposed to high levels of diesel, as well as in transportation and warehousing. So in total, occupational exposure to diesel engine exhaust accounts for approximately 224 lung cancer diagnoses each year in mining. And then in addition, approximately 200 cases of bladder cancer are also diagnosed annually in Canada, which may also be from exposure to diesel engine exhaust. And for the mining industry, this equates to approximately 22 bladder cancer diagnoses per year. And then the last one here with mining in the top 3 was nickel compounds. So inhalation of fumes and particles through welding or nickel refining, any skin contact. These are the primary routes of occupational nickel exposure, and approximately 170 lung cancers are diagnosed by nickel exposure in Canada each year. So this accounts for a little less than 1% of the lung cancer diagnoses. But ultimately, in the mining industry, this again equates to approximately 17 lung cancer diagnoses per year. So this is just all to put it in perspective for how many people each year would receive a lung cancer diagnosis based on just their occupation, exposures of their occupation. So as an employer, what are your responsibilities when it comes to occupational respiratory hazards? In essence, you need to know what your workers are being exposed to, and this can be done with different forms of audits or assessments for designated substances. You need to establish controls to protect your workers, identifying job-specific tasks if possible, so always having a high-risk priority tasks, deal with those controls first. And then we're going to always provide information and instructions to workers about the hazards associated with occupational disease, and constantly encouraging your workers to report any suspected exposures. So when we apply the hierarchy of controls to respiratory hazards, as always, ideally we would like to eliminate the occupational exposure entirely if possible. Again, if possible, we would try to substitute the materials and use one that would reduce the occupational exposure altogether. More often than not, we use the bottom half of the hierarchy of controls. So engineering controls that prevent workers' exposure to chemical or biological hazards in underground and surface mines, for example, providing adequate ventilation to designated work areas. For administration controls, we could provide training to enable workers to recognize occupational disease hazards, design work procedures for reducing dust production, for example, wetting the work, as Kimberly mentioned, and provide training for workers on the prescribed use of their PPE. So in the respiratory hazards cases, the respirator is a control, and it's the last line of defense against respiratory hazards. We always want to use all the other ones first. But in the case of using a respirator, it's important to understand that there are two types of respirators. We do have supplied air and air purifying respirators. For supplied air respirators, there's the Airline unit, which consists of compressed breathing air. It's portable supplied air or a clean ambient air system. The air is supplied to the user by a hose attached to the wearer's belt. So this allows for quick disconnecting in an emergency. The self-containing breathing apparatus uses a cylinder of air carried by the wearer. So the SCBAs are awkward, heavy, and require frequent cylinder changes. That's one of the things. And then there's a multifunctional unit, which uses a combination of both, and it's available for working in confined spaces and other high-risk assessments where reserve protection is required. More commonly used are the air purifying respirators, so just understanding that there are also 3 versions of these with the particulate filters, gas vapor cartridge filters, and a combination of both. So particulate filters, they're designed to remove solid particles such as dust, fumes, or mists and operate like the air filter in a car engine. The device may be filtering face piece respirators or respirators with replaceable filters. Different grades of filters are available depending on the size of the particle to be removed. For particulate filters, when they're used more often, they actually become harder to breathe through, but they become more efficient as a respirator. Whereas with the gas vapor cartridge filters, they're going to absorb or neutralize the gas and vapors. Unlike particulate filters, gas vapor cartridge filters become less efficient the longer that they're used. So they act like sponges, and when they're full, allow gas or vapor to pass through without being absorbed. So there are some differences in the nuances of which filters you're selecting, but just always be aware that if you're aware of these differences, then you can make the right selection and change them as appropriate. Then there's a combination filter, and it will remove particulate matter, vapors, and gases from the air. So just a quick, prior to using a respirator, for those of you who don't know, you do have to be fit tested. It can be done at 60 cell safety, costs about $20, takes approximately 15 minutes. You have to be clean shaven, so November mustaches have to go. You can't smoke for 30 minutes prior to the test, and then the brand of the respirator you're fit tested for must match the brand you're using. So for example, 3M or North are a couple of brands. Also, if you have any weight change, plus or minus 10 pounds, this can change your mask size. And your fit test expires after 2 years, so you have to regularly get it updated. So when you're using your respirator in the workplace, once you've put on your respirator, do the negative and positive pressure checks. Negative pressure, you cover the inlets and try to inhale. A properly fitted respirator is actually going to collapse a little bit slightly, and it's not going to permit air into the face piece, so it'll collapse on your face and there should be no leaking. For a positive pressure check, cover the exhale valves, the one in the middle, and try to exhale. The face piece will actually puff out a little bit, but it should not actually leak. There shouldn't be any air leaking. And then additionally, for respirator use, always practice good hygiene techniques. So constantly washing your hands, washing the respirator, have a change of clothes if necessary, use coveralls. Always want to leave the dusty work at home, or at work, sorry, and not take it home. So just a couple things here. According to the Occupational Health and Safety Act, as a worker, it's your duty to operate equipment in a safe manner. This includes your PPE, so your respirator. Report any defects in your equipment and report any known workplace hazards to your supervisor or employer. You should always be made aware of whether there is exposure to designated substances in your workplace and use the proper PPE as required. As a supervisor, it's your duty to ensure your workers comply with the OHSA regulations, ensure any equipment, protective devices or clothing required by the employer is used and or worn by workers, so this would include the use of the respirator. Advise workers of any potential or actual health or safety dangers that are known, and if prescribed, provide workers with written instructions on the measures and procedures to be taken for workers' protection. Always taking every reasonable precaution in the circumstances for the protection of your worker. And then these are ultimately exactly what the employer is responsible for on the supervisor and worker level, with a couple of more what to prepare and review at least annually: the written occupational health and safety policy for the workplace, and develop and maintain a program to implement that policy. They always have to post the OHSA copy in the workplace, and then establish an occupational health service and surveillance program for workers as prescribed. So any kind of respiratory hazards, there should be a medical surveillance program within that workplace. And then just to summarize, when it comes to respiratory hazards and occupational disease prevention, when we're talking about dust, it is quality over quantity. The visibility and the amount of dust is not an indicator of a hazard. It comes down to what is actually in the dust. You have to know. So be aware of respiratory hazards. Know what is in the dust in your workplace. Know what precautions you must take to protect yourself. If you don't know, don't be afraid to ask. And then understand that chronic exposure to respiratory hazards does have negative health outcomes such as lung cancer. And ultimately, we are all responsible for ensuring every reasonable precaution has been taken for our protection. And this is just a little quick disclaimer that the findings and conclusions in this webinar are those of the authors and do not necessarily represent the views of CROSH at Laurentian University. CROSH is funded by the Ministry of Labour and the Northern Ontario Heritage Fund Corporation. For any specific questions, and I think we're going to try and provide the links to our technician or technologist, Brandon will try and provide the live links from Kimberly. And then Kimberly and I are actually going to welcome any questions at this point.
Thank you. Start with the online question. So given mining industry related exposures and overall burden, are there other worldwide jurisdictions that we can look to learn and improve approaches to prevention?
Yeah,
Anywhere.
Oh,
you can pick it up from here if you want.
Yeah, sure.
Many, but Australia tends to be a good country with some experience in mining. I think Kevin mentions quite often BH Billiton as an industry leader, and you guys have even at Laurentian Morocco and working on some controls from an engineering standpoint, some exhaust filters right on, and going electrical. So there's lots of best practice places to go.
Any questions here from our audience here? Okay. So the contact information is there, and then for any other questions, you'll be directed to the CROSH website, and there's other email addresses there. So if other things come up, then feel free to ask. The webinar will be posted online as well in a couple days. And so that's it for our webinar for now. Thank you very much, Kimberly and Katie, for presenting.
Thanks for having us.
We're taking a little bit of a break in December, and then we'll be back January for more. So you won't hear from you won't get a big